Hi guys, welcome back to my channel. I hope you guys are doing well. In this video, I am going to answer some of your assumptions about being a medical registrar. A medical registrar in the UK is basically equivalent to a senior internal medicine resident in other countries. For those of you guys who are new to my channel, I am Lavanya and I am currently working as a medical registrar in the UK. So for the first assumption, you don't always answer your bleep. When I am on call, I try and answer my bleep within 5 minutes. But if I am doing a procedure or having an important discussion with a patient, I normally hand over my bleep to the SHO and ask them to let the person know that I am busy. But I can definitely understand why some med regs don't always answer their bleeps. Sometimes you just get back-to-back bleeps and it is so hard to keep on top of it. So please be patient and do bleep again in a little while. If it is something really urgent, put out a voice call or a medical emergency call. So the next assumption, you don't get a break when you are on call. Of all the specialities, I think medical on calls definitely gets the short straw. I have been doing purely medical on calls for the last 3 years, and I don't think there was ever a time when I had nothing to do. There is always so much to do in medicine. On calls in other specialities like surgery, obs and gynae, or peds, there is usually a lull at say 3 o'clock in the morning, so you can get a decent break, but it is definitely not the case in medicine. The next assumption, you can't say no to a referral. At 3 o'clock in the morning, when you already have 20 patients waiting to be admitted, it is just not worth arguing over a referral. To be honest, it depends on your consultant and the hospital you're working in. At the end of the day, an admission is an admission. We are a team and we are working for the same cause. My consultants have always been supportive and has never questioned the referrals I have accepted. And specialties here in the hospital that I'm working in are really great in reviewing the patient if necessary. Most specialities will kindly review the patient every day if necessary, even if the patient is admitted under medicine. So basically, I will accept anyone as long as they are above the age of 16. So your 88-year-old with a pubic rami fracture for conservative management referred to medicine. Your 99-year-old with bowel obstruction for conservative management and palliative care referred to medicine. Your 66-year-old male with uncomplicated pyelonephritis referred to medicine. Your 24-year-old overdosed patient with active suicidal ideation but no acute medical issues referred to medicine. And even your 38-year-old pregnant patient with suspected PE referred to medicine. I know this is not the case in most other hospitals. Some medical consultants are very strict and simply will not accept any inappropriate referrals, like if their primary diagnosis is not a medical one. I have seen so many disputes among ED registrars, medical registrars, and surgical registrars just solely based on referrals. Tears have been shed, friendships have been broken because of this. In my previous trust, there is a chart in the ED department called How We Work Together. It is a referral guide that has been signed by all specialities and the medical director. It really makes things clear which referral goes to which specialty. I think all hospitals should have something like that. The next assumption, you don't like late referrals. This one is true. If you have already made the decision to admit the patient, I rather know about the patient early on rather than being told about the patient later in the day. The next assumption, MedReg is the busiest job in the whole hospital. I honestly don't know because I have not done all the jobs, but it is definitely harder than being an SHO. During the day, it is not so bad because there are consultants around and other specialities if you want a second opinion or need some advice. But sometimes at night, it can feel like the whole hospital lies on your shoulders. But always remember that there is always a consultant on call. Most medical registrars are in training, and all doctors in training must be given adequate support at all times. This is a requirement by the GMC, so you shouldn't be afraid to contact the consultant on call, even if it is in the middle of the night. The next assumption, you're not a fan of medical outliers. For those of you guys who don't know, medical outliers are basically medical patients that are in another ward, say a surgical ward, because there are no medical beds available. In an ideal world, there should not be any outliers, but outlying medical patients is not new. Almost all trusts I've worked for have medical outliers in other wards. What annoys me is when I don't have a hold on all the medical outliers, especially if they are moved to another ward on the weekend or at night. It is hard to be responsible for a patient you don't even know exists. That is all for my video today. I hope this video has answered some of your assumptions about medical registrars. If you have any more assumptions or questions, please leave it in the comments down below. Please give this video a thumbs up if you liked it. Subscribe to my channel for more videos, and I'll see you in my next video. Bye!